I think that kind of thinking has gotten us in trouble. I'm being very honest. I believe that I would replace the Bush tax cuts with tax cuts for the middle class and to reward companies that create more jobs. In other words, you know, there's the higher level, there should be equity in the tax system. But I believe in tax cuts for the country to become green, tax incentives, and you know, for an Appolo program, public and private investment, yes, spending, and tax cuts to become green. And that's an Appolo program to reduce our dependence on foreign oils. I don't mind that solar energy companies make a little money, they create jobs, and, you know, and retro. I think there's a huge job market for America, especially in California, for high-wage jobs and creating renewable energy companies and retrofitting homes. You know, and I would ask every American on my energy plan to sacrifice. In other words, do something about being more efficient with light bulbs and heating, and air conditioning, and washing machines. I have a fuel-efficient vehicle. I doubled the fuel efficiency in 10 years. I would, climate change, I got the strongest policy. I think we can reduce greenhouse gas emissions by 2050 by 90%. I think they gotta be aggressive mandates, not goals. You know, beware the politician who tells you, this is my goal. Well, you know, I'd have a mandate. I'd have a cap and trade system. This is the cap, and this is how you achieve it. So, no, on healthcare, I believe that you can have a national healthcare plan or a universal plan, and I believe it can be financed by dealing with the existing inefficiencies in the system. I really do. By 31% of all our healthcare costs goes into bureaucracy, goes into administration, goes into the fact that there are no electronic records. I mean, this is something you guys should look at more of it. We have health information systems that are totally inadequate. That patients and doctors can't, you know, share records of people that have problems. Then I do existing reforms, like allow every American to purchase a congressional health care plan. Medicare is done by the feds, Medicaid by the states. I would have Medicare, I'd allow those 55 and over to purchase it. I know this is, you guys don't care about it.
Of course we do.
Yes, we do.
We want to.
I know you do. My only point is, look, the first way I would pay for a national health care plan is existing inefficiencies, 31%. We spend $2 trillion on health care. We're already paying for the uninsured in emergency rooms. You know, secondly, the war in Iraq. You're spending $400 billion there. I'd shift some of those to health care. I mean, those that tell you, oh, you can't do it because they're fungible, but you can do it. I would also have what Massachusetts and California are starting to do, and that is everybody pays their fair share in health care. The employer, the employee, the state, the federal government. And those that can't, you give them a little break. You give them a little subsidy. Those, you know, some poor guy that works at this convention center, you know, you give them a little incentive, not a tax cut, you give them a little subsidy. And you hold down insurance costs. So it's more personal responsibility. You know, Ron, if all we said was we're going to tax the rich to pay for everything, pretty soon you're going to start hitting the middle class, which already is.
Would you repeal the AMT or fix it?
The
alternative?
Yeah, I would fix it. I mean, the middle class is really, right now, the rate of inflation has made the middle class very vulnerable in the next few years. Absolutely, I would fix it.